Hi, my name's Allison. I'm a yoga therapist, social worker, doula, and hypnotist in Davidson, North Carolina. Today we're going to go over 10 exercises to help low back pain. It's one of the most common ailments that people come to me with, and almost everyone at some point or another in their lifetime experiences low back pain. This could be due to weight gain, to just the posture or your seating, depending on what your job is, and it can also be due to pregnancy. We're going to go over 10 exercises that can be done in under 20 minutes to help you, and things that you can do at home as well. So why is this important? One of my all-time favorite books is Yoga as Medicine by Dr. Timothy McCall. He went through tons of research across all different fields, including medicine, and found in several studies, totaling over 1,000 people, 98% reported that yoga helped their low back pain. One of the other awesome studies that he touches on in his book is one that was done at West Virginia University School of Medicine. Kimberly Williams did some research on around 40 people who were doing 16 weekly yoga therapy classes, and she was doing a randomized control study, which means there was another group of people who weren't able to take the yoga. But the yoga people had amazing, amazing results. So 64% reported reduction in low back pain. 77% reported reduction in functional disability, which means that they could get through their lives a little bit easier. And 88% of the yoga group were able to either eliminate medicine or significantly reduce their medicine that they were taking to help with their low back pain, compared to only 35% of the control group. So we know from the research that yoga can help. So the exercises we're going to do, some come from this book, some come from Yoga for Wellness, which is Gary Kraftsaw's style of yoga, and some come from Judith Lassiter. So these are all some awesome books that I would highly recommend if you're interested in learning a little bit more. So let's get started. First of 10 exercises. It's called Pawanmuktasana, or wind relieving posture. Part of what this exercise does is increase proprioceptive awareness, which is an awareness in your body of very subtle changes. Most people, when they're experiencing low back pain, bear down and hold on and try not to move. So we become frozen as opposed to nuanced. And so this is meant to help move the joints in a way that releases synovial fluid, which is kind of a joint lubricant, and also simultaneously increases your proprioceptive awareness, which means that you can just notice some of those subtle changes. So you can really feel when your back is actually starting to feel better. So let's get started. You can do this in a seated posture or lying down. I recommend doing this personally very first thing when you wake up. When you hit the snooze button in bed, you can do these exercises. They're fantastic any time of day, and you can't do them too much. So we're going to start just rotating the wrists. It's a really subtle movement. And you might start to hear some creaks and cracks and crunchies as you move all the anxiety, all the stress that's been stuck in the joints out of the body. And then I like to do each finger, and I'm just doing little circles in one direction and the other, and then pulling, just very slightly. So I hold on to the nail, go in one direction, the other, and a gentle pull. So you'll do this with each of your fingers, and just notice if you have any arthritis or kind of aches and pains, you might feel it a little more on one finger than the other. Just simply notice that. And we've done our wrists, our fingertips, then we move to the elbows. So just little circles in one direction and the other. Your shoulders, so rotating your shoulders back and forward. And if you were in bed, you might want to start with your feet, but then we'll do our toes. So just little crunchies in your toes, a little bit harder to circle your toes. One ankle, and the other. One knee and the other. Good. Maybe even opening your hips a little bit and closing. And take a moment to just notice how just those very subtle movements have affected your experience in your body. This is pose number 2 of 10, Chakravakasana, or moving child's pose. This pose helps to activate the core as well as to stretch the low back. I want you to think about keeping your core inside, so pulling in a lot of the techniques we talked about in the diastasis recti video. Belly's engaged, core is nice and tight. Sometimes when people have low back pain, it can indicate a weakness in the core. So you might try and do a lot of crunches and sit-ups. That can actually make the problem worse and exacerbate low back pain. So what we're trying to do is stretch and strengthen in a really subtle and gentle way. If you do a bunch of crunches, you might tighten the core, but you can also strain the low back or tighten the psoas muscle. And we'll talk about that a little bit later. But neither of those will help alleviate the low back pain. This pose can be an excellent way to help stretch the back. So let's get started. Hands and knees, shoulders are right above your wrists. So a nice strong angle there. If it's too much in your wrists, you can either be on your fists or you can roll up a blanket so that you have a little more of an angle there. Your hips are right above your knees and your knees are about hip distance apart. So as you exhale, round up through your spine like an angry cat and slowly sink your hips back towards your heels. You might let your forehead rest on the floor or a block or book. Inhale, coming back up to a neutral spine. Remember, core is engaged. Inhale and exhale just to notice any differences there. We'll do that 2 more times. So again, on an exhale, rounding and sinking, feeling space between each vertebrae. And inhale, coming back up to neutral. 1 more time, rounding, exhaling back, and inhaling back up to center. A variation that you can take on this, if you'd like, is to bring your right knee back, maybe 2 to 3 inches from where your left leg is. And to do that again, 2 to 3 times. Exhale, rounding and sinking, keeping your hands planted where they are. You should feel a nice big stretch through the right side of the body and maybe into the right low back. Inhaling back to neutral. Exhale, rounding. And inhaling up. To add to this, you can extend that exhale, maybe even making the exhale a bit longer than your inhale. The exhale is where the relaxation part of the nervous system is strongest. So if you're making your exhale longer, you know you're going to calm your body down. We'll do that on the other side. Left knee comes back 2 to 3 inches. Right knee stays where it is. Hands stay planted. Exhale, rounding. To add even more to some of the subtle benefits of this pose and the mental health benefits, as you exhale, you could hum, and that'll extend the exhale and also stimulate the vagus nerve, which helps to calm the body. So if you'd like to, that's always an option. Inhaling up and exhale. Coming back to neutral, and we always want to neutralize the spine, so we'll do that again with knees in line. Taking 3 more, rounding and sinking on an exhale. Right? Extending the exhale just helps to pack a little more power to this pose. So much of pain is your perception of pain. Right? They've done lots of studies on people with herniated discs. Some people might have a herniated disc and experience absolutely no pain, where others could have just a small herniated disc and have severe pain. So a lot of this is perception, and if you really place your emphasis on the exhale, you're going to soak up the benefits both physically for the low back as well as mentally and emotionally. So that's pose number 2. Let's move on to number 3. Pose 3 of 10, Vjrasana, Chakravakasana variation. For this one, we're aiming to strengthen the core. If it puts any strain on your low back, just stop and go back to the second pose. So for this one, belly in towards spine, tailbone drops, pubic bone lifts, and your pelvic floor is lifting too. Everything around your core is engaged. So on an inhale, you're gonna come up onto your knees. If you have any knee issues, you might wanna use a blanket to pad your knees. Exhale, coming down, forehead rests on the floor or a block, hands rest on your low back. Inhale, belly's tight, core is engaged, lifting up. Exhale, coming down. If you lift your drishti, your gaze slightly when you come up, that'll help to elevate the mood. Inhale, lifting, core is engaged. And exhale, coming down. You could do that 7 to 10 times, or you could take a different variation. If it's too much, lifting up on the inhale, exhale, coming back down, and then to break in between, inhaling up to hands and knees. Exhale, rounding into your cat and coming back down. And then inhaling from hands and knees and coming up. Keeping your hands on your body will give you a little bit more support as you come down if it puts too much pressure on the low back. So it's an inhale up and an exhale down. When you finish, just pause in a moment of stillness. Notice any sensations and any feelings that you're having in your low back. Make your way onto your bellies for pose number 4 of 10, Bhujangasana, Cobra pose. For this one, your forehead rests on the mat, palms are by your low ribs, elbows pulled in towards each other. It's important to keep your neck in alignment with the rest of your spine so you're not really pulling your head up. Your chin is slightly tucked. As you inhale, press into your palms and slightly pull your torso up and forward, exhaling down. And it's almost as if your pubic bone is an anchor here, and the rest of the spine is moving forward and up, and exhaling down. See if you can relax your glutes here. Inhale, lifting, and exhale, coming down. There's very little pressure in your palms other than just to pull down and back. So if I were just on the hardwoods here, I would actually pull myself forward on the hardwood floor. Exhale down. Take 7 to 10 breaths moving in this way. And on your last breath, go ahead and exhale, relax. It might feel good to wiggle your hips side to side or to windshield wiper your shins. Go ahead and make your way onto your spine now. If you were on your belly, just go ahead and roll to your side and start to pull the knees in towards your chest and onto your spine. Pose number 5 is Apanasana. So for this one, your hands will just rest gently on your knees. If you can't reach your knees, you can always use a strap here. And as you exhale, slightly pull the knees in very subtly. Inhale, pressing the knees away. Right? And remember, we're trying to extend the exhale. So exhaling, inhaling. And this pose just very gently massages the low back. It's also very good for your digestive system. And you can give yourself a little bit of freedom with this if it feels better to rock from one side to the other, using the weight of your legs to massage your low back, as well as some of the acupressure points in the sacrum, the hips, that lower spine. So you can either move with your breath or just move in a way that feels good for you. And remember, exhale pulls the knees in, inhale presses away. And as your diaphragm extends, it kind of presses the knees away. And as you exhale, you're squeezing the air out of the diaphragm. Take about a minute in this posture and then come back to rest. Asana number 6, Supta Eka Padangustasana, or a fancy way of saying stretching your hamstrings. If you sit at a desk all day or you walk a lot, your hamstrings might be really tight. Tight hamstrings can definitely contribute to low back pain. So for this one, we're going to do one leg at a time. Your feet could rest on the floor. You can inhale and extend up through your left heel, and you might just hold gently behind your leg here. Exhale down. Inhale, extending, and exhale, coming down. I'll do that 3 more times with this leg. And see if you can take up the full span of your inhale with your movement and the full span of your exhale, which means you might be moving a lot slower than you actually want to. Good. We'll do the other leg. Right leg comes in, inhaling up. If it's challenging, exhaling down to hold the back of your leg, you can always use a strap to hold that leg up. Another thing that you might notice happening here is that as you get to that full extension, the leg might want to tremor a little bit, and that's okay. Just allow that to happen. And when you've done 5 on each side, you're welcome to do 5 with both legs. Inhaling up, exhaling down. Flexing the feet will give you a little bit more stretch in those hamstrings. Two more. Moving with your breath. Inhaling up and exhaling down. Last one. Good. Bring your feet back to the floor and take a moment to just notice how you feel. How did that one movement change or affect anything subtly or drastically in your body? Asana number 7, Dvipada Pitham, a variation on bridge. For this one, interlace your fingers above you, just above your shoulders. And as you inhale, your feet are about hip distance apart here. Your arms are loose, like limp spaghetti noodles here. So we're inhale, lifting the hips up. And again, your glutes are somewhat relaxed here as much as you can. Exhale, press your knuckles up towards the ceiling as if someone were holding your hands, and slowly, vertebrae by vertebrae, lower your hips back down to the earth. Good, so we'll do that again. Your arms are relaxed. Inhale, press through your feet. Lift your hips up slowly. Gaze stays up towards the ceiling. You never want to turn your head side to side in this one. Exhale, press through your knuckles. Slowly, with control, lower your hips back down. Good. 4 more. Inhaling up. Arms are relaxed. Exhale, coming down. Inhaling up, arms stay relaxed. Exhale, coming down. Feel that stretch through your shoulders. Good. Inhaling up. Keep your knees pointed forward. Sometimes the knees want to stray here a little bit, side to side. So just keeping your feet active, your knees active. All 4 points on your feet are pressing into the mat as your hips lift. And as they lower, vertebrae by vertebrae. And when you do your last one, just come back to rest. Take a moment and notice any differences in your body. For asana number 8, we brought a prop in, a chair. You could use a regular chair, a kitchen chair, or the wall as well for a supported half pigeon. So for this one, we're gonna cross your right ankle over the left knee. And your left foot could either be resting here in a 90-degree angle with your knee, or you could start to hug that left foot in the knee in. If you've got a lot of flexibility, you can really use the chair to support you here in that stretch. And you're working on stretching out the piriformis muscle and all through the glute med and the glute max. So we're gonna do about a minute on either side. This might be a really strong stretch for some people, and this might be a little bit more subtle and a little bit more effective, depending on how tight your hips are. So again, about a minute on either side. Let your breath move into wherever you're feeling this most. You might even envision your inhale moving into that hip, expanding that space, and as you exhale, just letting it remove any stress or tension that you're loosening up here. Go ahead and switch sides. And let go of any expectations of symmetry for the two sides. A lot of times we get ourselves hooked here thinking that we need to have symmetry. The only thing that should be symmetrical really for sure is your ankles here. So your foot is flexed to protect your knee. And then if this side is a lot more tight, you might kind of loosen up. And if it's a lot more flexible, just go in a little bit deeper into that stretch. So honor where you are in your body in this moment. If you've got a lot more room, just take it a little bit deeper. Let your body guide you. And that's developing the proprioceptive awareness here. So as you inhale and exhale, notice and look for those very subtle changes in the body. And that'll be your cue to go deeper or to back off. Pose number 9, legs up the wall or legs up the chair. I'm using the chair variation here. So my knees are at a 90-degree angle, my feet are just resting, and I have a pillow here supporting my legs. You could also prop your head and neck up with a pillow if you need, or roll a washcloth up just under your neck to support your cervical spine. This pose has tons of benefits, so we'll stay in it for 3 to 4 minutes just to let your body absorb all of the benefits of the pose. If it's too much pressure on your low back, feel free to come back to just hugging your knees in towards your chest, or to take a different pose that would be more comfortable for you. This pose helps the blood to kind of relax down the legs. Your heart doesn't have to work quite so hard in this pose. And because your legs are propped up either on the chair or on the wall, the blood starts circulating and flowing back up towards your carotid artery, up in your neck. Inside your carotid artery are lots of little receptors called baroreceptors. When they feel that rush of blood, they start going off and saying, ooh, maybe too much blood going up to the brain. And it signals your brain to release a hormone that naturally reduces your blood pressure here. So this pose can help with insomnia, it can help with high blood pressure, it can help with low back pain and anxiety and general stress. So just allow yourself to sit back and relax in this pose. It can also be a good one to do right before going to bed. Pose number 10, Shavasana. It's important for your Shavasana practice, whether it's a home practice or in a studio, to have something under your knees if you have low back pain. So from your spine, you might bend your knees and just place the bolster or something like a pillow under your knees. I like to prop my feet up as well, just to keep my legs supported. So relaxing onto your spine, letting your arms relax out, maybe putting something under your neck or shoulders, and just allowing yourself to again absorb all of the benefits of your practice. Taking a couple of deep breaths. Notice any subtle shifts or changes in your body. Notice how your low back feels and scan the rest of your body. And just allow yourself to enjoy this state of peace and calm for a few more breaths. And when you're ready to come out of Shavasana, go ahead and hug your knees in towards your chest. Take some rocking movements in one direction or the other, and rock over to one side. take a moment to honor your body and your experience. And when you're ready, press into your palms, making your way back up to a comfortable seat. A couple of other lifestyle things to be aware of is to notice your transitions. So you want to keep your shoulders and your hips in alignment when you're transitioning, whether that's in between postures and asanas in your yoga practice or just in day-to-day life. So in our Shavasana, we rolled to the side and then used our upper body to press ourselves back up. You want to rely on your legs and your upper body to support your low back. One of the biggest mistakes I see some of my clients making is that if they're in low back pain, they're not wanting to get up and then sit back down again often. So they'll be seated and then go to pick up a child or something heavy and turn to the side to pick it up, right? So you're turning to the side, picking something up and seated. That's the absolute worst thing you can do for your low back. It puts a ton of spinal load on those low back discs and can really put your low back in danger. Another thing that I see people with low back pain do is take a yoga class and try and reach for their toes. Sitting down and folding forward is, again, one of the worst things you can do for your low back. You put a ton of weight on that low back and it can really torque your spine. So pose number 6 that we did today can be a really great way to stretch your hamstrings without folding forward. Standing up and folding can also kind of torque that low back. So when you're lying down, that's your safest place to do your yoga practice and to stretch and strengthen at the same time. When you're feeling a little bit better in your low back, you might move to some of the other asanas that are from a seated position or standing up. But just be gentle with yourself right now. If you do this practice, it might make a difference. If you notice anything feeling worse, just make sure to take it easy, to step back and to listen to your own body. That'll be your most important messenger. Thank you for joining me today. I hope this video was helpful. Check out my other meditation videos on YouTube and look out for a couple of other yoga therapy videos that'll be coming out soon. May all beings be happy and free from suffering, free from the roots of suffering, beginning with you here today. Namaste.